ICD-10 Code for Immobility. ICD-10 Code for Immobility. ICD-10 Code for Immobility. Immobility is a medical condition that affects a person's ability to move around. A physical disability may cause a person to be wheelchair-bound or reliant on a wheelchair to move about. Another cause may be a musculoskeletal disorder or loss of function in the legs. An ICD-10 code for immobility is M62.3. M62.3 is used to specify paraplegic immobility syndrome. An ICD-10 code for immobility is F01ZFCZ, which is a billable code for evaluation of mobility. The ICD-10 code for immobility is Z46.89. In both codes, the diagnosis is the same. However, the ICD-10 code is more specific and is used to report a patient's disability. To avoid this, the patient should seek medical attention for any underlying medical conditions that might be causing the malaise. The ICD-10 code for immobility is Z74.09. It is a billable ICD-10 code for dizziness or giddiness. The ICD-9 code for dizziness is 780.4. The ICD-10 code for giddiness is R42. Its description is similar to the ICD-9 diagnosis of dizziness. There is no ICD-10 code for vertigo or fainting. The ICD code for immobility, R26.2, is used to describe the symptoms of an illness. It is short and describes the symptoms of difficulty walking. While it is useful in diagnosing a medical condition, it cannot be used for reimbursement purposes. It is a diagnosis that is difficult to identify. ICD-10 has several guidelines for coding malaise. The patient must be evaluated to determine the appropriate treatment. The ICD-10 code for immobility is R26.2. Its definition is a short description of the patient's inability to walk. The condition is not a disease itself. It can be caused by a range of conditions, including a heart problem or an autoimmune disorder. But the patient should be monitored carefully. The doctor will assess the patient's mobility level and use the code accordingly. A symptom of immobility can include any type of abnormality in the gait. An abnormality in gait is a deviation from the normal walking pattern. These symptoms may indicate common problems in the musculoskeletal or nervous system. Getting plenty of rest and exercising regularly can help minimize the symptoms of malaise. In addition to using an ICD-10 code for immobility, the patient should be able to walk normally without assistance. Symptoms of immobility may be a sign of a musculoskeletal or nervous system disorder. An abnormal gait is a common sign of a malady. The patient may be experiencing immobility due to a disorder, or simply due to a musculoskeletal problem. There are many ways to minimize this condition and prevent it from becoming worse. In addition to getting regular rest, patients may also engage in regular exercise. In ICD-10, an immobility code is a code that indicates that a patient is not walking normally. The patient is in pain and has difficulty walking. This is a common indication of musculoskeletal problems. In most cases, an abnormality is a sign of a musculoskeletal problem. It is essential to see a physician for a diagnosis to determine a cause of immobility. If an individual is experiencing immobility, a musculoskeletal disorder is the root cause of the disorder. An individual with a musculoskeletal disorder may experience difficulty walking. An abnormality can be the result of a musculoskeletal disorder or a neurological condition. ICD-10 code for immobility is M62.3 in the pieces format. Its CM equivalent is Z46.89 in the CM version. When a patient experiences dizziness, the doctor should diagnose this condition. ICD-10 code F41. 9 is a billable ICD-10-CM code that can be used to indicate a medical diagnosis for reimbursement purposes. This code is included in the 2020 edition of ICD-10-CM. For more detailed information on this medical condition, see the ICD-10-CM article for BPPV. An ICD-10 code for immobility is R26.89. This code is a billable ICD-10-CM code, meaning it can be used for reimbursement purposes. It is important to note that this specific ICD-10 code can refer to a medical condition with the same name. An example of this condition is central vertigo, which is caused by disease in the central nervous system. This disease causes nausea and vomiting.